Cervical cancer screening. Cervical cancer is one of the most preventable types of cancer. When it is time to be screened for cervical cancer, you will receive an invitation in the mail from the Ontario Cervical Screening Program. Cervical cancer screening is recommended for anyone with a cervix between the ages of 21 and 69 who has ever been sexually active. You should be tested once every 3 years. The cervical cancer screening test is called a Pap test. It can find early cell changes on the cervix. Your test will be done by a specially trained nurse or healthcare provider in the privacy of an examination room. You will be asked to lay on your back on an exam table. An instrument called a speculum is gently inserted into the vagina so that the doctor or nurse can clearly see the cervix and gently take a sample to be sent to the lab for testing. A copy of your cervical screening results will be mailed to both you and your healthcare provider. If follow-up tests are required, you will be notified by your healthcare provider. Having follow-up tests does not mean you have cancer. Once you have started screening, you will receive a reminder letter when you are due for your next cervical cancer screening. It is known that the main cause of cervical cancer is the human papilloma virus, HPV, a commonly sexually transmitted virus. One way to protect yourself from HPV is by getting the HPV vaccine. The HPV vaccine is available to all grade 7 students as part of the publicly funded immunization program. The HPV vaccine is effective in preventing some of the high-risk strains of HPV, but it does not protect against all forms of HPV. That's why cervical cancer screening is important. You still need to be screened if you feel healthy and have no symptoms, are no longer sexually active, have only had one partner, are in a same-sex relationship, have been through menopause, have no family history of cervical cancer, have received the HPV vaccine. You can get screened for cervical cancer in your community at the health center or nursing station. If cervical screening is not available in your community, you can visit the mobile cancer screening coach if it is available in your area. If you have to travel outside of your community for follow-up testing, funds may be available for travel. To book an appointment with the Ontario Cervical Screening Program, call 1-800-461-7031 or 807-684-7777 or talk to your healthcare provider. For more information, visit www.tbrhsc.net/cancer screening.